H3N2 is the latest health scare for people in India, as at least 2 people have succumbed to the H3N2 subtype of seasonal influenza. According to data shared by the Health Ministry, at least 451 confirmed cases of H3N2 have been found so far this year. Now that's concerning, especially in the aftermath of the COVID-19 pandemic. Our experiences have taught us that we should not take any such issues lightly. But have you wondered? This typically isn't the flu season. So why are the cases rising at the moment? According to experts, this is because of the delayed flu season. Another peculiar thing that they have found in this flu season is that some patients are experiencing an atypically prolonged course of infection. So what's more important is to know who these people are and who need to be more careful about H3N2. Allow our expert to tell you.
They are more severe in people who are immunodeficient. That means people who have some underlying immune deficient condition. For example, elderly patients or patients who are pregnant or patients who have long-standing uncontrolled diabetes or hypertension, patients of chronic kidney disease or chronic liver disease, or patients who have some sort of underlying malignancy or a rheumatological condition, or a patient who is on steroids for a very long time. So these patients are immunocompromised patients. And these viral infections, they are more severe in these immunocompromised patients, and these individuals can even be hospitalized because of H1N1 or H3N2 causing a pneumonia.
So now it's clear that high-risk patients should be more careful at the moment. At the same time, it is wise to know the symptoms so that the treatment begins at the right moment and the infection doesn't spread to many people.
Now in this season, what we are observing is that these patients have a very transient fever or sore throat or body ache or a runny nose. The patient may even have diarrhea. And after that, there is a slightly prolonged course where the rest of the symptoms resolve, but the severe hacking or distressing cough lasts for a little longer time, maybe 2 weeks or even 3 weeks or even 4 weeks, and patients who are immunocompromised, that means patients who are elderly or children or pregnant women, they may also be hospitalized because of this.
So if you come under the high-risk category, it's important to note these symptoms and also take steps to prevent the infection or stop it from spreading. If you have any symptoms, then it's better to stay at home and take primary care in consultation with your doctor. You should also avoid any gatherings and wear a mask for added safety. There are vaccines available as well, which are effective against such infections.
Vaccination for influenza has to be annual. That means if you have taken a flu shot last year, the guidelines recommend that you are supposed to take a flu shot every year during the flu season or the winter season. That is because the strains in the vaccines keep on changing, and these strains are decided upon based on the flu viruses that are circulating in that particular season. Now, certain high-risk groups like the elderly patients or those with comorbidities, which I mentioned earlier, also need to take their pneumococcal vaccine. The pneumococcal vaccine has to be taken by individuals more than 65 years or those with comorbidities, but that has to be taken just once in 5 years. But the flu shot has to be taken every single year.
We hope this video gave you more information about the H3N2 virus. Do let us know in the comments what more would you like to know about this infection, and do subscribe to Shosha for more such health content.